Hello everyone, I'm Dr. Nicholas, I'm a GP, and today I want to talk to you about red light therapy. So what is red light therapy or red light in general? Well, red light therapy refers to exposing the body to specific bands of visible red and near infrared light. The reason for doing this is because some people say that it may have a role in skin anti-aging and a few other benefits such as decreasing inflammation, skin pigmentation, and even muscular or arthritic pain. Now, there is some truth to that, but the evidence greatly varies, as we will see in a minute. So how does it all work? Well, the energy from the red light particles are absorbed by the skin and by an enzyme in our cells, which then triggers our repair genes and makes them work harder. So you can think of it as some of your skin cells getting a very targeted coffee shot. It just increases their energy and makes them work more. Devices such as the one in the background, they generate red light or near infrared light at various wavelengths. There are four wavelengths that have been the most studied, and these make up about 70% of red light studies on websites like PubMed. There are two main superficial wavelengths. So these are 630 and 660 nanometers, which gives the red light color. And the near infrared um, wavelengths are 830 to 850 nanometers. And this is the near infrared light, which you can't actually see with the naked eye. The shorter the wavelengths, so the red light, um, doesn't penetrate very deep into the skin. So this is when the red light is mostly used for anti-aging skin purposes. Longer wavelengths are such as the ones like 830, 850. They penetrate deeper, so this can help with muscle recovery. And some studies have shown it to also work on things like brain injury and arthritic pain from like knee arthritis. But the evidence is not quite there yet. So in terms of the studies available, there was a really good and quite thorough 2018 systematic review that looked at several red light studies, and this confirmed there was some improvement in skin texture with the 630 nanometers and 660 nanometer protocols. And the 830 to 850 were useful in pain relief, according to some meta-analyses of other studies. So if you remember nothing else from this video, just remember 660 nanometers for surface work and 830 works best for deep tissue work. Okay, so this panel here, let me show it to you a bit closer. Let's put this here. This panel itself includes exactly those four peaks. So 630 to 660 and 830 and 850. It's split 50-50 between red and near infrared LEDs. It packs about 60, well, it packs 60 LEDs in total, okay? And this is the baby of the Mito range. So it's portable, comes with a desk stand, and it only uses about 90 watts of power, so that's good for your electricity bill as well. Okay, so what else do we have here? So we have a touch panel on the side with settings. So here you can choose the mode. So you can choose whether you want just red light or if you want just near infrared light, so those higher wavelengths, or you can have a combination of the four. So you can actually have all four wavelengths on at the same time. You can set the time. So say 5, 10 minutes, whatever, you can increment it by 1 minute at a time. And after this, the device will actually stop. It will turn off. And you have the OK button, which actually turns on the power for you to use. So yeah, you just set the time. And then when you press OK, this happens. See, the panel actually comes on. Okay, and then you can put it on the desk or on the floor, and you can use it. It also comes with a handy remote control. So this is the remote control. But as I said, just setting the timer can actually be very, very useful. So as I said, this is the baby of the Mito Pro red light range, and it's the Mito Pro 300 Plus. You may have seen the Mito Pro X, which seems to be the more popular version, but that one is a bit more expensive. And I think the reason why it's a bit more pricey is because it has things like Bluetooth, so you can connect it to an app. And it also includes two extra wavelengths, I believe 590 and 610. However, there is very little extra evidence that those two wavelengths do anything in addition to these four ones that this unit already offers. What else? Because it's only available in America, which is where I purchased it from, you may need to use an adapter if you plan to use it in the rest of the world. There are other alternatives in Europe and in the UK. One of them is Bond Charge, from what I can recall. However, the main problem I have with Bond Charge is that they actually only offer two different wavelengths, which I think is 660 and 850. I just wrote them down. So they only offer two wavelengths, and a lot of the studies actually were done on the 630 nanometers wavelength. So I'm a bit unsure why they chose to exclude that, but I'm sure they must have a good reason. So how do I use the unit? Well, I aim for 5 to 8 minutes per treatment area. So if I want to use it for the face, I will do about 5 minutes, 5 to 8 minutes every other day. I keep the panel at about 25 centimeters or 10 inches away from me. So that's about this much, right? That's about this much. This is 10 inches. You don't want to get too close because then you'll get a lot of heat exposure. But you don't want it to get too far either, because then the red light or the near infrared light is not going to work as well. And it can help with things like skin wrinkles, acne scars. If you want help with those, then you just need the red light itself, so the 630 and 660. If you want help with things like sore muscles or maybe knee arthritis, those kind of things, the evidence is less for this that it's going to work. Though some studies have shown an improvement in symptoms, but it's not fully there. The evidence is just not fully there yet. But you can try it. Everyone responds differently to these kind of things, and it's generally safe. The other thing to note is that, of course, you can use both spectrums together as well. The thing is, don't forget your eye protection. So Mito Red Light, they actually supply two types of goggles. So they supply this style, or they supply these ones. You can use, either of them, depending on which one you find more comfortable. And, it's generally considered low risk therapy, but of course it's not substitute for medical care. So if you have any chronic medical problems, or if you're worried about any acute changes, or anything at all, make sure you see your GP, see your clinician first, so they can rule out anything more serious. And also, if you're on medication or suffer from chronic issues, make sure you ask them about red light therapy before you just start doing it yourself. So this is how I use red light as part of my longevity toolkit, and this Mito Pro 300 Plus really ticks my evidence boxes. You can try some of the other models. Obviously, they have bigger panels if you wanted to target more of your body at the same time. This one, by the way, you can also you can hang it onto the door. So if you just want to stand and you use it that way, you can hang it on the door, or you can just put it on the desk. So this is the one I would actually recommend, because I don't think it's worth spending extra money on getting a Bluetooth enabled red light panel. I mean, how many times are you going to use that, really? So if you found this video helpful, or if you have any questions, let me know. Give it a thumbs up, subscribe, and let me know what you would like me to test next. I'll see you soon.